If you're planning to start a family, you must have heard, track your ovulation or have intercourse during your ovulation. But what does this ovulation mean? Does PCOS affect your ovulation? You must have heard a lot of these questions and you want to know answers to all of them. Watch this video till the end in order to know the answers. Ovulation is a monthly process in which egg is released from your ovaries. This egg travels from your ovaries through the tubes into the uterus. It waits in the tube for the sperm in case if sexual intercourse happens at the time of the month, and if it gets fertilized, you get pregnant. If no, the endometrium lining sheds, that means you get your periods. In regular menstrual cycles, in which your cycles are usually 24 to 35 days in length, you ovulate 14 days before your menstrual cycle. Usually this pattern remains the same and it is easier for you to track your ovulatory period. But that's not the case with PCOS. In PCOS, your cycles are irregular and either you do not ovulate or you ovulate irregularly. There are some subtle signs which you can notice during ovulation, and to name a few, they are: number 1, increase in basal body temperature. Your basal body temperature increases slightly by 0.5 to 1 degree Fahrenheit just before you are ovulating and remains so till the end of your menstrual cycle. So if you measure your temperature every day before getting up from your bed, you can keep a track of when you are ovulating. Number 2, having egg white-like consistency of cervical mucus. Just before your ovulation, the mucus secretion from your cervix increases profusely and becomes thin and sticky. You can see that discharge in your underwear, and that means that you are ovulating. Number 3, breast tenderness. Number 4, mild abdominal pain. Number 5, abdominal bloating. Number 6, light spotting. Although signs like breast tenderness, abdominal bloating, spotting might be very subtle and not all women see those changes, hence they are not very reliable. But still, you can track your ovulation if you notice the other signs, and especially if your periods are regular. Tracking your ovulation in PCOS can be tricky, but it is not impossible. We have newer methods also like ovulation kit and fertility monitors which can measure your urinary hormone levels. These signs are subtle, they are difficult to track, but if you do it on a regular basis, it gets easy and you are able to form a pattern. But if you feel that you are not ovulating or your ovulation is becoming irregular, get in touch with your doctors. If you're looking for a personalized guidance and treatment for PCOS, join Veera Health where our experts provide you with a customized plan to treat your symptoms and concern.